Alzheimer's research scientist, actually a drug discovery scientist. You all heard from Paul, he'd like to have some disease-modifying drugs, but he doesn't make them. You hear from Larry and Rusty, having this fabulous research, but downstream of that research, we actually have to move from the disease in a dish, or what is, to something that's a drug. To you, that would be a pill. Inside that pill is a chemical, and that is a very special chemical. It goes into the human body, does more good than harm, and actually, in a pinpoint accuracy, is altering a part of a disease process, and so doing, improving the disease. So research in San Diego is at a very interesting sort of crossroads. On the one hand, we have some world-class research. I think Mary touched on this before. It is undoubtedly world-class. It's not just the guys sitting around me here. You can go and look in any report. It will tell you it's the best there is. On the other side, we have clinical research and trialists. It's the top of the game, too. And in the middle, we also are fortunate to have two institutes at the Sanford Burnham Previs and at the Scripps Research Institute that have enabled themselves as non-for-profit institutes to be able to conduct what is ordinarily thought to go on in a big pharmaceutical company. That is this search through hundreds of thousands of chemicals of different shapes and sizes to try and find the one that could be the drug that could interfere with that process you think is defective. Larry was just mentioning defective trafficking. Maybe we try and find a chemical that could improve that trafficking. That could be a drug, but we have to search for it. And so we actually have worked with Larry already in doing such a process, using his disease in a dish, trying to screen through existing drugs to see if anything could actually be repurposed. But in general, we're going to have to come up with something that's completely new. So in my role in this is really try and enable researchers with the passion. All of it starts with researchers who have that deep knowledge and insight, the passion to move it to the next step. Now, I worked in a pharmaceutical company for 15 years, at one point running a large operation of drug discovery. What was disappointing to me, and I'm sure for many researchers, was that people would come up with an idea, and we would go, nah, it's kind of early, kind of risky, I don't think that's going to work. And you know, most of the time we're right. But the trouble is that's not good enough. We have to pick the one. Sooner or later we have to do more. We have to do more parallel efforts. Many pharmaceutical companies are working on the same project. We have to do something different. Here in San Diego, we are in an exciting and unique position. We have the basic research going on who have already generated the ideas. We have two non-for-profit research institutes are enabled with cutting-edge research capabilities in the drug discovery aspects, or the robotics, the miniaturization, the large chemical libraries. We can join those two together. So what do we need to do? The goal is clear. We need to come up with disease-modifying drugs. How are we going to do that? We need to get organized. And we have got organized. The C4C, which Collaboration for Cure, which Mary mentioned already, is the beginnings of that. Projects from amongst the institutes were selected or requested, and 8 projects have already started to begin that. These are new, innovative ideas, and we need to embrace more of those. That is how we're going to come up with something that is first in class, transformational. This is not going to be a little incremental thing that might be a little different. This has got to be something that is truly different. So I'm excited about that. I'm excited for San Diego. I'm excited to be part of it. I'm excited to be able to enable it. I am not an Alzheimer's researcher, but I am touched by it. My family was touched by it badly, I have to say. So it was very devastating to it. And I have pledged much of my time to want to act, to try and do something about it, and use the art that I learned in a pharmaceutical company to do something that's tangible, that actually can make a difference. So I'm excited to be here. I'm particularly excited at how engaged the community is. Nothing makes scientists more passionate than your support to kind of cheer them on behind, because a lot of what we do doesn't end up in something productive, and we have to do it again and again and again until we get there. So thank you.